Hi, my name is Dr. Stelina Gowdy. I am a board certified family physician practicing in Athens, Georgia. And the topic that I'd like to discuss today is cervical cancer. This month is Cervical Cancer Awareness Month, so I thought it would be a good topic to discuss. So, how do we screen for cervical cancer? The way that we perform cervical cancer screening is by doing a pap smear. The uterus is consists of different parts, and the end of the uterus is called the cervix. And what we do when we're screening for cervical cancer and we perform the pap smears, we're basically getting some cells from the cervix. That sample is sent to the lab, and then the lab essentially tests or checks the cells to see if there's any changes in the cells that would be consistent with cervical cancer. There are different levels. So there is early signs of changes to the cells, and then there's later signs of changes to the cells on the cervix. The pap smear used to be performed every year. Some of us may remember that every year we had to perform a pap smear. I am one of those. However, the guidelines changed. And the reason why they changed the guidelines is that they found that HPV virus is what has leads to cervical cancer. So now we are able to test for that virus when we are performing the pap smear. Therefore, we no longer need to perform pap smear every year. Now, if you've had a pap smear that is abnormal, the recommendation in your case may be that you do need to perform a pap smear every year. Another reason why you may need it every year is if you have a history of breast cancer. In that case, we do recommend that we perform a pap smear every year. However, for the average person, starting at 21 years of age is when you need to start performing pap smears. That also changed a few years back. And starting at 21 years of age, so 21 to 30 or 29 to be more specific, we essentially check for the cells to see if there's any changes that would be concerning for cervical cancer. If that's abnormal, then we reflex it to HPV. But if it's normal, just that initial test, just looking at the cells is enough. Now, if you are 30 years of age or older, we do also perform the HPV testing when we're checking the cells. We can even stretch out the pap smear to every 5 years when we're doing both, checking the cells and checking for HPV. However, most providers have decided or like to do the pap smear every 3 years, mainly just so that we don't stretch it out too long and then you forget that you haven't had a pap smear in a long time. 3 years seems to be a good amount of time so that we can make sure that it's getting performed. And the reason why we want to make sure that a pap smear is being performed is that if you are making sure that you're getting it done, you can reduce your risk of cervical cancer significantly. Cervical cancer is a very slow growing cancer, so you have a lot of time to be able to get it done, but you don't want to wait. So as soon as you notice that there are some changes, then that's when you want to move forward to the next step to do a biopsy or an additional testing. However, if you're waiting too long, like for example, if it's been 5 years, 10 years, now the cancer may have had time to grow. And of course, as you know, with all cancers, the sooner you detect it, the sooner that we can essentially treat it, and then the better the outcome, which is essentially the same thing with all cancers. So really important that you go ahead and do your pap smear on the regular basis at a minimum every 3 years. Now, if you do need to get your pap smear done, we do perform pap smears in the office at Gowdy Family Care Center. So if you need to get your pap smear done, given that it is Cervical Cancer Month and it's time to get it done, come on in. We're happy to see you at Gowdy Family Care Center. Our phone number is 706-410-2684. Or if you'd like to find us online, www.gowdyfamilycare.com. Looking forward to seeing you.